Hello, everyone. Welcome to the latest episode of the Healthcare Innovation Podcast. Today, our guest is Khushboo Aggarwal. Khushboo is currently the founder and CEO of Zyla, one of the fastest growing startups in the healthcare industry in India today. I have known Khushboo for a long time. I've known her at college. We both went to the same B school. And I've known her when we both used to work at Deloitte, consulting and advising multinational clients. And then I've known her in this new avatar as a founder, successfully starting and then running a company. So welcome, Khushboo.
Hi, Purav. Thank you so much. It's such a pleasure to join you today.
Thanks, Khushboo. So Khushboo, there are lots of topics to talk about, but maybe for our listeners, if you can start with your introduction and a little bit about your journey.
Sure. So Purav, I am a heartfelt healthcare lover. I've been doing healthcare for more than 12 years. Did pharmacy honors and MBA as my training. And then I did a whole lot of healthcare consulting, as you know, with Deloitte. So healthcare comes naturally to me. I love the challenges that come with healthcare. And I have dedicated my life to solve the patient-centric problems that exist in our country. So I would say until 2017, I was deep into healthcare consulting. 2015, I was actually on a project in the US for a large healthcare client. And that's when my dad had an unfortunate sudden heart event brought on by his long-term diabetes. I was working in a pretty utopian market of the US where, everyone's fully insured, things are taken care of. And the biggest problem you have to solve is avoid people running to the ER for every little symptom. Whereas when my dad had this problem and I had to come back to India suddenly and solve this for him for the next 6 to 9 months, was spent shuttling between home and hospitals, I realized that the problem here was whole different and a pretty big one, right? So there is hardly insurance coverage in the country, even though my dad was insured. His problems that he was facing in terms of symptoms, health issues were sort of ignored, and he was not able to manage them on time, which led to the unfortunate heart incident. When I went deep into the problem after this, I realized that every family was facing this. In fact, more than 80% of the people who have, say, diabetes or hypertension, similar health condition, would end up with an untimely heart attack or kidney failure. That's a problem I went on to solve. And in 2017, founded Zyla, found some very like-minded people who wanted to be on this mission with me, and built out Zyla as a conversational health management platform where we understand a person's health in depth and continuously guide them, manage them for the most personalized healthcare intervention that they need to keep them healthy and prevent the next hospitalization.
Nice. That's interesting how you pivoted on your journey from working in a multinational company to taking on a mission and starting Zyla. But Khushboo, this must not have been easy. This would have been a difficult switch, I imagine, from my previous interactions with others. How did you manage the switch? What were some of the challenges that you faced as you went through this transition?
Right. So Purav, I would say it requires somewhat of an epiphany moment for you to shake yourself out of a very comfortable zone where you're earning well, you've got the most reputed brand backing you where you are, you've got all of the international travels and perks that come with it. Your family is all happy because you went to the best brand B school and colleges and you seem to be doing well in life. To really shake yourself out of it, it requires almost of a shock, which was my calling, what happened on the personal front. And I think that level of passion is a must, Pura, for you to sustain on this journey, because it gets hard, it gets difficult. How much ever glamorous it may seem on the outside, entrepreneurship is no joke. So I would say I had to make myself mentally ready. And I told myself again and again why I want to do this, and that purpose, so to say, kept me going. On the other side, I would say I'm a healthcare enthusiast and my skill is all healthcare. The problem I was trying to solve, and when I went deep and met thousands of patients and almost played secretary to hundreds of doctors to really know what is going on in India, because a lot of my work was in the US, I realized that I will need to be with the patient 24/7. I will need to be a part of their life. And it was impossible to do just through humans or physically in a physical setup. I had to use technology. I had to go digital. I had to be a part of their devices and phones and whatnot, right? And from there, the vision sort of started forming, Purav, that I wanted to make Zyla as this de facto healthcare platform that sits in every phone, every household, takes care of you as your confidant. So to solve for this, the biggest challenge I faced was finding people who would complement my skills. So I had to very quickly find someone to lead my technology to really drive this vision of healthcare tech with me, while I would handle the healthcare part and the intricacies of it. I needed someone to really build out the technology that was required.
Makes sense. Khushboo, can you talk about some of the other challenges that you might have faced as you shifted from US to India market? Like how much of it was similar and how much of it was different? How did you handle it? I understand you spoke to stakeholders, but maybe some of the differences that you can highlight for our listeners.
Sure, sure. So, Purav, it's a very, very contrasting market and a very interesting contrast, right? In the US, everyone carries a health insurance card, right? Which means all of your healthcare, be it a hospitalization or a doctor visit or a pharmacy buy or a diagnostic test, is all covered by a network which is provided by your insurance company, right? And this insurance is sort of co-paid by you and either your employer or the government. Majority, like 98% plus of the developed markets are fully insured, right? That's how that market works, which means healthcare, when I need healthcare, it's driven by my insurance, right? So if, for example, when I was in the US, I had Aetna insurance, I had to go for a wisdom tooth extraction. I just went to the dentist, I showed my card, I got the treatment done. Later on, there was a whole lot of documentation that provider did, the dental clinic did, to show to my insurer that this was the treatment required for me and this is how they carried it out and these were the outcomes for them to get paid by insurance. Correct. So it was fully sponsored by my insurance. So this means there is transparency. I can sort of be comfortable that the treatment that was given was required and fair and someone was watching out for me. Whereas when you come to India, only 20% or so of the market is actually insured, and that too just for hospitalization, right? So that means when I go to a doctor visit, an outpatient treatment, or I'm getting a radiology test done or a lab test done, I'm paying out of pocket, and there is no one to oversee. Was it required? Were the outcomes delivered? Is this person now doing fine? Right? So the incentives get misaligned, right? Why is the insurance really caring about that in the West? Because they've solved the problem of acquisition of users, and they're now solving the problem of preventing hospitalization, reducing claim rates. Correct. While in India, we are so early in terms of insurance coverage that insurance companies are still solving the problem of acquisition of users, and they have not yet focused on how do we ensure the person stays healthy? How do we start covering OPD? How do we ensure the user is engaged and not going to get hospitalized? How do we contract with those providers, doctors or hospitals, to ensure the treatment is fair as per certain structured care pathways, right? Those care pathways are absent in India. So I think that was the most interesting sort of contrast. And I thought that here was the opportunity, right? I could really use my skills and my learnings and actually create that infrastructure or ecosystem that's required in India and that's missing.
Understood. Understood. So that's a good way to delineate the macro level picture, because that then translates into every decision you make when you build the solution. Another topic again of which I find interesting and nowadays is also talked about is were there any specific challenges that you faced as a woman when you became an entrepreneur, and how did you solve those?
Right. So Purav, I would say there is this point of certain biases that exist in the market, right? That women are not as aggressive or women are conservative when building a business. Can a single solo female founder actually build a large business? That you have to sort of manage and counter by really proving yourself out. There is no shortcut to it, correct? And I think I have seen that to some extent, although I think the ecosystem has really evolved now and people are funding women-led startups, and there is a lot of talk on how women actually bring in empathy in healthcare, are even better leaders for healthcare than men. So I think that is one which will take some time to phase out in our country. Other than that, I would say was finding people in my team who were as empathetic, who were actually as mission-oriented as I thought I was. And thankfully, I was able to solve for that, right? Just by forming a very strong vision, communicating it, over communicating it to people. And, my best of people, majority of my team today is women. And that is based on skill and empathy that they bring in, no other reason. So I would say that was one of the challenges. Other than that, Purav, I mean, I'm very blessed to have a family that's supportive, and I think this is more of an outlier than a general sort of an event in someone's life, wherein I have my husband, my mom-in-law who really supports me while I run business. They run the house. I have a 1-year-old child. It may seem difficult for someone to think that as a young mother, I'm able to do this, but because of the support of the family, I'm able to really manage, be with him late evenings after my work gets done, while my family takes care of him while I'm at work.
That's great to hear. In fact, I would argue that nowadays more and more families are being supportive, and I can relate to it so much. So when we started Healthark, at one point, 80% of the team was women, and today also I think more than 50% of team are women, and they've been really skilled. So not just empathetic in terms of healthcare, but even consulting, taking on some other areas like strategy, product management. Right. They're equally good, arguably better in some of the areas. And I see that nowadays more and more families are being supportive. Companies are also trying to be more supportive, and it works out well. So glad to hear that you're also following the same pattern at Zyla. Now, one question I always have to ask people who come from a consulting background is, we do a lot of innovation within consulting, but it comes from a different vantage point. So how do you see the difference when you try to do that kind of work when you were in your consulting career, working with large organizations versus doing it in a small startup environment?
So Purav, I would say it was a great start for me because it allowed me to know how to use frameworks, how to think in a framework thinking methodology, how to solve for ambiguity. You're given this massive, large problem by the client with no data, and now to just solve for it, right? And we launched $1 billion drugs in the US. We launched, complex cancer biologics in emerging markets. We, at Deloitte, led the internal development or acquisition of patient engagement platforms for large insurance companies. So these were big problems to solve, right? However, part of the difference really is that the universe that you were working in was still pretty structured and defined, right? Where there's this client who's coming in with some background work, some indication of how things are going to pan out. There is a team that you're working in that is already hired. There is no dearth of number of people you could put on a project or lack of funds. You always had the supporting technology team. Deloitte is so massive, right? So we had this innovation hub and, the Deloitte technology arm that you could pull in and take help from. So it was a very, very figured out ecosystem, although the problems were ambiguous and huge, right? We've solved some of these together. When you jump into a startup, things drastically change, right? You're no longer this hero on the project who the client is, so fond of, and, a large team at your disposal, and your, taken care of sort of thing goes away. You have to solve for everything from how do you figure out funds to hiring team to really the problems that you have to solve are also not figured out, right? So first you have to figure out what problems you have to solve, right? From the large startup idea to the sub problems. And it gets really, really complex, right? You have to run at 100x the pace, and you have to build really, really fast. You may fail at hundreds of instances, and you have to resurrect yourself, figure it out, and keep running, right? So I think it's altogether different in terms of resources, the pace, the ambiguity, the complexity, and the sheer persistence you need to stay focused.
Yeah, no, I can relate. Like some very simple things like invoicing or accounting. I never knew that such things existed. It just
Correct.
happened in the background, and now having to figure out and build a system around that. Uh, just there are just so many variables that get added to your life. Now, I'm sure you are also going through these and many more. Uh, One question, right? So when you started 4.5 years ago,
Hmm.
you were the founder. How has your role evolved as a founder over these years as the team grew, the product matured?
Mhm. So, Purav, early on, you have to do everything as a founder, right? As you rightly said, you have to register your company, you have to figure out your legal paperwork, you have to figure out an office setup, you have to figure out setting up your email IDs to the first hire, to the first pitch deck, to the product sketches of the wireframes, the medical care pathways in our case. So everything I did on day one, it was a lot of fun. I think that is sort of that high of, the first year of a startup where you're doing just everything. Slowly, you figure out things and pieces, and you find people to run those, right? And you find great people who may even do it better than you. That's the beauty of building a startup. You should always find people who are better than you. My role from there, to recruiting the first person, building out the first care pathway, the admin, the tech, and all of that has now evolved to a place where I find new growth areas for Zyla, right? So I have people who run my medical, I have people who run the tech team, people who run the product team, people who run growth initiatives and brand marketing. I have a full-time HR team. So all of those pieces are well handled. While I figure out new growth opportunities, I structure them out and I find people who will then support and run it. So I would say, you continue to be an entrepreneur every day, whatever be the stage of your business, as long as you're in a growth phase.
Makes sense. Makes sense. I think one word I caught on to, which I want to elaborate further on, is the high of entrepreneurship, right? Yeah.
Hmm.
So there are challenges. There is so much written about it. 5, 7 years ago, maybe there was not enough literature on challenges of being an entrepreneur, but now it's talked often around the amount of work, the speed at which you have to run. But what is most satisfying? Can you talk a little more about that high of entrepreneurship? What is that feeling which keeps you going?
Right, great question, Purav. So, Purav, I would say the greatest high, if I have to just structure it in 2, 3 points. Number one would be building something, building something which the world needs, which does not exist, right? So, not repeating something which is there and figured out and doing it well, but actually building something out that is highly impactful and the world needs, correct? The second bit I would say is around choosing amazing people you can work with and learning with them, right? So I could have never, if I was not with Zyla, I could have never understood technology the way I understand it now. We actually build ML algorithms from scratch within months, which I sit with the team and conceptualize, right? It's so exciting. We've actually built the most complex NLP engine to understand the conversations our patients are having with us. There was no way I could have done something that extensive and advanced in tech if I had not started out with Zyla, right? Or for example, I work with the best of doctors in the country because we were very, very strict SLA as to which doctor gets into Zyla, and they're all in-house. So I'm able to actually interface with the real face of healthcare, the empathy of healthcare in its true sense, right? So I think those are the two things that are high points for me every day, and the reason I would never ever want to do something else.
Wow, that's a strong statement. Never do something else. Uh, well, so Khushboo, for our listeners, right, and many of them are aspiring innovators. Some of them would eventually also become entrepreneurs. A lot of them will innovate. Some of them will also be entrepreneurs. What are some of the key learnings that you want to part them with based on your journey, based on the grind that you've gone through where things work, things did not work?
Right. Well, number one, I would say is know your purpose. I mean, I know this line is overused maybe in entrepreneurship, but it's really, really true. Because the reason why most entrepreneurs may not be able to persist is because the purpose was not as clear. When you're feeling low, and entrepreneurship is a very lonely journey. You will feel low at times. You really have no one to complain to, right? People will come and complain to you left, right, center, but your battles are your own, and you have to persist, and you have to lead the team with a smile, how much ever tough the situation be. At that time when you're feeling low or you're feeling lonely, your purpose is what will keep you going. So really know why you want to do this, and really pick a problem that's close to your heart, where your heart lies, right? Not something which is in the news, fashionable, or seems very, very exciting. There are no shortcuts. There is no quick money in entrepreneurship, something that one should never aim for as the reason to go after. It has to be a big problem that's close to your heart that you want to solve. The other thing, Purav, I would say is really know your life stage, right? So when I started out Zyla, I knew that even if this took years, a decade, I was ready, and my family was sort of taken care of and managed, right? Because in the end, you have to take care of your family. You need to feed your family. You need to ensure they're comfortable. So that part, to some extent, you have to know is taken care of, because you cannot put that on the line. It may take years, right? And that's when you will start losing patience if that bit, is not figured out in terms of your family being comfortable.
Got it. Got it. Well, that makes complete sense. So, Khushboo, thanks so much for sharing these thoughts with our listeners, and thank you for your time. We wish you and Zyla all the success. I'm personally a big fan of the solution, and I know it would do great in terms of impacting diabetes as well as overall health in India and globally. So thanks so much once again for being here.
Thank you so much, Purav. It was such a pleasure. Take care.